I'm Dr. Edward Petzer. I'm a cardiologist who specializes in general cardiology, but particularly arrhythmia, device, and autonomic cardiac dysfunction. When I initially became a doctor, believe it or not, I wanted to do veterinary, which is a strange take, but that's the truth. But through the course, eventually I decided I wanted to deal with human beings, so that's how I became a doctor. But I always just know I wanted to try and prolong life and look after life. So that was the reason I went into medicine. The reason I did cardiology was an interesting answer. I was very interested in hyperbaric medicine, so I thought I was going to work on dive chambers in the North Sea, etc. But as I rotated through cardiology in Wellington, New Zealand, I was put into a cardiology rotation, particularly with device therapy. And that was in probably 1997. And since then, I never looked back. I just really enjoyed cardiology and it just gelled with me. So I found cardiology by chance through my training process, but it definitely suits me and suits my skill set. When I was a younger doctor, I would say completing a complex operation probably was the most rewarding. But as I've matured in clinical medicine, it's just getting things right for the patient, the right communication, the right drug, the right treatment plan, getting the patient to the right source of treatment. So it's more holistic would be my great reward I get from medicine. That can take many forms, obviously. It does take surgical forms as well. But for example, I had a patient who was started on a beta blocker after a heart attack, and she came to me feeling tired, lethargic, unwell. All I had to do was stop the beta blocker, and literally within a few days, she was like a withered flower that came back to life, and that's exactly the word she described. So some simple things as simple as that can be what I find rewarding. To be a true doctor, I think maybe the greatest skill is to learn the art of listening. The patients always know what's wrong with them. Maybe they don't know the right word or terminology, but you as the doctor just need to understand what they're saying and really compute it with medical knowledge and medical process. So I would say that's the one thing I think my patients value the most about me, that I listen to them and I try and respond to their needs and get them sorted, basically. I'm very end driven. I don't like procrastination. I like getting things sorted for the patient. So I'm always looking to see what the issue they came to me, what their problem is, and what I can do to resolve it for them. And that's how I function. And that's how I look at life, and that's how I look at how I practice medicine.